everyone. This is Dr. Nikita Consul from the Academy of Online Radiology Education. I work at Baylor College of Medicine in Houston, Texas. This month we have curated some interesting papers in gastrointestinal imaging. This study, published in AJR, was a retrospective review of more than 2,800 adult patient presentations for right upper quadrant pain, which were reviewed for the comparative diagnostic value of cholecystitis and other pathologies by ultrasound and CT. There was no significant difference found between ultrasound and CT for cholecystitis, but CT was found to detect acute non-gallbladder pathologies in 32% of cases that were missed on ultrasound, whereas the reverse was not true. CT was therefore concluded to be non-inferior to ultrasound for the diagnosis of cholecystitis in adult patients and was found to offer other advantages as well. This paper, published in Radiographics, provided imaging cases of various abdominal pelvic calcified lesions, as well as a diagnostic approach to these calcifications. They were described as being possibly benign, premalignant, or malignant, and therefore using clinical information, the location of the mass, and the morphology, it is important for the radiologist to be able to diagnose these, and so this approach was meant to assist with that. In this case report published in Clinical Nuclear Medicine, a patient with occult cecal adenocarcinoma detected on PET-CT originally presented actually with endogenous endophthalmitis. Endogenous endophthalmitis, due to Clostridium septicum, is a rare ocular infection, but it is highly associated with GI and hematological malignancies. Therefore, PET-CT was suggested by the authors as being considered in any patients with endogenous endophthalmitis to rule out any occult malignancy. This study, published in the European Journal of Radiology, was a retrospective evaluation of 49 rectal cancer patients who had available histopathology and preoperative rectal MRI. There are 4 region of interest or ROI methods that are used to measure ADC intensity on reduced field of view diffusion weighted imaging or RWI. These 4 methods were compared, including the whole tumor volume or WTV method and the single slice or SS method for their diagnostic value. WTV was found to have the best diagnostic value for the assessment of well-differentiated tumors, T2 stage tumors, and N0 status. However, WTV also took the longest measurement time, while SS took the shortest. The authors concluded that WTV had the best diagnostic value overall for histological characterization of rectal cancer. This paper, published in Abdominal Radiology, was an imaging review with multiple image examples of various anatomical regions of the peritoneum and Morrison's pouch, as well as examples of associated disease pathologies. Knowledge of the complex anatomy of the peritoneum and any diseases that are associated with Morrison's pouch can help the radiologist to diagnose these pathologies. In this paper, published in Radiographics as part of the Fundamentals curriculum, the authors provided imaging examples of various pathological conditions of the stomach, including neoplastic, infectious, inflammatory, and emergent diseases, all of which they conclude that the radiologist should know how to diagnose. This radiographics paper features imaging examples of abdominal wall masses, as well as a diagnostic algorithm to differentiate between these different types of masses that can be seen along the abdominal wall. The author suggests to begin with determining whether the mass is a hernia versus a fatty, cystic, or solid mass, and then also considering whether there is an underlying diffuse disease process or not, and provide diagnostic algorithms accordingly. This study, published in AJR, was a retrospective comparison of the radiation dose utilized between 85 pediatric patients who underwent contrast-enhanced dual-source dual-energy CT versus 66 patients who underwent single-energy CT. Radiation dose was found to be significantly reduced in both the chest and the abdomen pelvis when using dual source dual energy CT versus single energy CT. They also found that the contrast volume was 19 to 22% lower when using this dual source dual energy CT. Therefore, they concluded that dual source dual energy CT can reduce both radiation and contrast dose. This study, published in the Journal of Computer-Assisted Tomography, was a retrospective evaluation of the imaging from 90 patients who had metal found in the abdomen or pelvis on CT. And they applied the single energy metal artifact reduction, or CMAR, algorithm to determine the effect on artifact severity. They measured artifact severity both objectively and subjectively and found that artifact severity significantly decreased in the near field of high-density metallic implants, decreased to some extent in the near field of low-density metallic implants, but was objectively similar in the far field of low-density metallic implants or high-density metallic implants. Subjectively, the artifact severity was found to be decreased all around. They concluded that the retrospective application of CMAR could reduce artifact severity from both low and high density metals, both objectively and subjectively. This deep learning study, published in Investigative Radiology, featured a fully automated segmentation tool for connective tissue compartments using the open source convolutional neural network called DeepMedic, being used on retrospective CT examinations from 1,143 patients. Segmentation of the subcutaneous adipose tissue, visceral adipose tissue, and skeletal muscle compartments was performed. The results showed excellent generalizability to both the routine CT diagnostic patients and on native CT scans. So the authors concluded that this open source convolutional neural network called DeepMedic can perform fully automated determination of body composition. And that's all from me for gastrointestinal imaging in the month of June of 2020. For more details, you can read our blog where you can find links to the original publications and full summaries. Please feel free to share your thoughts or any questions with us on the Gastrointestinal Imaging Forum, and see you next month.